I'm going to start this story with a phrase that still gives me chills just remembering it. Marina, there's someone moving down there. Down there. The morgue. Folks, I've been working in hospitals for over 12 years. I've seen a lot. A lot. I've seen premature babies fighting for life. I've seen elderly people saying goodbye with a smile on their face. I've seen surgeries that seemed impossible succeed. But what happened on that Tuesday morning, it challenged everything I learned in school, everything I believed was possible. Let me ask you a question before I start. Do you believe in miracles? Like, real miracles? Those things that science can't explain, that leave doctors speechless. Because after that night, I have no more doubt. I saw it, with my own eyes. It was around 3:30 a.m., that dead hour of the shift, you know? When the hospital gets that heavy silence, just the sound of monitors, ventilation machines, the air conditioning. I was in the 4th floor nursing station finishing some reports. Boring as hell work, but someone's got to do it. That's when my cell phone rang. Internal number. From the basement. From the morgue. My heart already did that weird acceleration thing. It's not normal for the morgue to call us in the middle of the night. Usually when someone dies, we do the whole procedure, send the body down, fill out the paperwork. Done. No reason to call after. Hello? Marina? It was Carol's voice, the nursing tech on shift in the basement. But her voice... Folks. Her voice was shaking. Marina, can you come down here? Now? Carol, what's wrong? Everything okay? I can't explain over the phone. You need to come. Please. The way she said it gave me chills all over. You know when you feel something is very, very wrong? I dropped everything and ran down. Took the service elevator. That old one that creaks like crazy and takes forever. Every second felt like an hour. When the doors opened in the basement, the air was already different. Colder. More heavy. I don't know how to explain. The corridor was kind of dark, just those emergency lights on. And there at the end, the morgue door half open, a yellowish light leaking out. Carol? I called quietly, kind of not wanting to make noise. Why? I don't know. Maybe because that place is naturally scary. She appeared in the doorway. Her face was white. Actually white, like paper. Eyes wide, hand trembling on the doorknob. Marina, you're gonna think I'm crazy. Carol, just tell me. What happened? She swallowed hard. There's someone moving in there. My blood froze. What do you mean moving? Carol, bodies sometimes have post-mortem muscle spasms, you know. No! She practically shouted, then covered her mouth, startled by her own volume. No, Marina, it's not a spasm. I heard moaning and banging. Someone's banging from inside one of the drawers. Good Lord. I looked at her trying to process what I was hearing. Banging. Moaning. From inside the refrigerated drawers where the bodies are kept. You absolutely sure? My voice came out firmer than I was feeling. Marina, I know how to tell the difference between pipe noise, air conditioning, old building. This is different. It sounds like someone trying to get out. I took a deep breath. Okay, let's go. We went in together to the morgue. That place always gave me an uneasy feeling, even after so many years. The fluorescent lights flickering slightly. The strong smell of disinfectant trying to cover the smell of, well, you know, the stainless steel drawers on the wall, all numbered, 8 total. 3 occupied that night. We stood in absolute silence, waiting. And then I heard it. A muffled moan. Weak, but real. Very real. You hearing that? Carol whispered, grabbing my arm. Yeah. My heart was beating so hard I swore she could hear it. Another moan. And then, A bang. Thud. Dull. Coming from inside one of the drawers. Drawer number 5. I approached slowly. My hands were shaking. I looked at Carol. She nodded, pale but determined. We were in this together. I put my hand on the handle of drawer number 5. Freezing. So cold it burned. I pulled. The drawer slid out with that characteristic metallic sound, and inside, covered by a white sheet. The sheet moved. I jumped back, almost screaming. Carol let out a muffled scream behind me. The sheet moved again. And then, a hand. A pale hand with purple fingers came out from under the sheet, searching, trying to grab something. My God, I whispered. With hands shaking so much I could barely hold it right, I pulled the sheet and looked straight into the open eyes of Michael Henry Santos. 28 years old. Death certificate signed 6 hours ago. Cause of death: cardiorespiratory arrest after drowning. Except Michael Henry Santos was breathing. Weak, irregular, gasping, but breathing. He was alive. Code blue, I shouted with everything I had. Code blue in the morgue. I repeat, code blue in the morgue. Carol was already running to the phone, dialing the ER, voice coming out stumbling. I grabbed my stethoscope, never imagined I'd use this in the morgue, and put it on his chest. Heartbeat. Weak. Very weak, but present. Between 30 and 40 BPM. Dangerously low, but present. Michael, I called, holding his freezing face. Michael, can you hear me? His eyes moved. Tried to focus on me. His mouth opened, trying to speak, but only a hoarse moan came out. Easy! Easy! You're in the hospital! You're safe! Help is coming! In less than 2 minutes, which felt like 2 hours, the emergency team invaded the morgue. Dr. Phillips in front, his eyes almost popping out when he saw the scene. What the hell? He started. I know how it looks. I cut him off. But he's alive. Thready pulse, beats between 30 and 40, shallow breathing, severe hypothermia. Doctor. Phillips didn't waste time with questions. Dr. Mode activated. Gurney, now. We need to warm him gradually. Warmed saline. Complete cardiac monitoring. Let's go. Let's go. We transferred Michael to the gurney with all the care in the world. He was freezing. Too cold. His body temperature must have been close to 82, 84 degrees Fahrenheit. Severe hypothermia. Purple lips. Pale skin with bluish spots. But alive. Impossible, but alive. While we ran up to the ICU, my head wouldn't stop. How? How was this possible? I myself had helped fill out the death declaration, had seen Dr. Morrison certify the death, had seen them take the body to the morgue. 6 hours. He'd been 6 hours in a refrigerated drawer at 39 degrees Fahrenheit. No detectable vital signs. Declared dead. And now was breathing. The ICU turned into an anthill. I'd never seen the team move so fast, with such urgency mixed with shock. Because that's what it was. Everyone was in shock. Core temperature, 82. 9 degrees! Nurse Paula shouted, looking at the thermometer. Gradual warming, Dr. Phillips ordered. Thermal blankets, warmed saline at 104 degrees, humidified and warmed oxygen. Nothing abrupt or will induce arrhythmia. I stayed there, helping where I could, but mainly observing, trying to understand. Michael was unconscious now, but the cardiac monitor showed that weak, irregular, but present trace. Vital signs slowly returning. That's when Dr. Martinez arrived. Neurologist. One of the best. She'd been called urgently. Explain to me, she asked, categorical. Dr. Phillips summarized while working. Michael Henry Santos, 28 years old, came in yesterday at 6 p.m. Rescued from drowning in the river. Firefighters estimate he was submerged for approximately 12 minutes. Arrived here with no vital signs. Team worked on him for 45 minutes. Continuous CPR, defibrillation, epinephrine, everything. Nothing. Flatline. Death certificate signed at 7:15 p.m. by Dr. Morrison. And now? Dr. Martinez looked at the monitor, incredulous. And now he's alive, I completed. Woke up in the morgue at 3:30 a.m. She shook her head, that expression of someone seeing something that defies everything they studied. 6 hours and 15 minutes, declared dead, in refrigerated environment. It's the mammalian diving reflex, Dr. Phillips murmured, but didn't seem very convinced. There are documented cases of survival after submersion in cold water. Hypothermia protects the brain, reduces metabolism. For 45 minutes without vital signs, after being declared dead, after 6 hours in the morgue? Dr. Martinez raised an eyebrow. Phillips, I've read all those cases. None compare to this. The silence weighed heavy. Because she was right. This had no explanation. We need to talk to the family, I said quietly. They were informed of the death. Imagine what they're going through. Dr. Phillips closed his eyes. My God, the family. Marina, can you... I'll go. I went down to the lobby with wobbly legs. There they were. Michael's mother, Mrs. Teresa, 52 years old, eyes red and swollen from crying so much. The father, Mr. Ronald, 56 years old, hugging his wife, trying to be strong. The younger sister, Julia, 19 years old, curled up in a chair, lost look. They'd spent the night there, waiting for the medical examiner to release the body, planning the wake. Destroyed. I approached slowly. Mrs. Teresa? Mr. Ronald? They looked at me, that empty look of someone who lost everything. I'm Marina, a nurse. I need you to come with me. Is it about releasing the body? Mrs. Teresa asked with a broken voice. How did I say this? How did I drop a bomb like this? Not exactly. Please come with me. Now. Something in my tone made them get up. They followed me to the elevator, confused, scared. Nurse, what's happening? Mr. Ronald asked. The elevator went up. Second floor, third, fourth. ICU. I need you to prepare yourselves, I said, my voice shaking. What I'm about to show you has no logical explanation. I opened the ICU door, took them to the bay where Michael was. Dr. Phillips nodded, giving permission. Mrs. Teresa looked through the glass and fainted. Mr. Ronald caught her before she fell, but he himself was swaying. Julia let out a scream that echoed through the entire floor. Michael! He's alive, I said, holding Mrs. Teresa as she came to. I know it seems impossible. I know you were informed of the death, but he's alive. He's fighting. He's here. Mrs. Teresa started crying, but this time it wasn't mourning tears. It was tears of, I don't know, shock, relief, disbelief, all together. How? Mr. Ronald managed to ask. How is this possible? We don't know, I answered honestly. Science, medicine has no explanation for this, but he's here. He's breathing. His heart is beating. Folks, I need to pause here for a second because what you're hearing, this really happened. I was there. I saw it. And even having seen it, it still gives me chills. Those of you who are following along here, who are part of this channel family, do you believe in miracles? Have you ever seen something that science couldn't explain? Share in the comments. From the heart. Because I think we need these accounts, you know? Need to remember, there are things in this world that go beyond what we understand. And if you're new to the channel, subscribe. Hit that bell because every week I bring real stories that will move you, will make you believe there's still hope, still mystery, still something bigger. Now, let me continue because what happened in the next few hours was even more impressive. We let the family in, one at a time, just to see, to touch, to believe. Mrs. Teresa stayed there, holding her son's cold hand, crying and praying at the same time. My boy came back. My boy came back to me. Michael's temperature started rising. Slowly. 84 degrees, 86, 88. With each degree, the heartbeats got a little stronger, a little more regular. At 6 a.m., his temperature was at 93 degrees. Still hypothermia, but moderate. Heart beating at 55 BPM. Spontaneous breathing. Still with oxygen support, but spontaneous. At 8 a.m., the whole hospital knew. Hallways full of doctors, nurses, techs, everyone wanting to see the morgue miracle. Because that's what they were calling it. The miracle. Dr. Morrison, the doctor who had signed the death certificate, came running, his face white as paper. I examined him. His voice was shaking. I put the stethoscope on his chest. There was no heartbeat, no breathing, fixed and dilated pupils. I have 30 years of medicine. I know when someone's dead. Nobody's blaming you. Dr. Phillips put his hand on his shoulder. You did everything right, followed all protocols. This is something none of us understand. At 10 a.m., Michael opened his eyes. I was changing his IV when I saw it. His eyelids trembled. Once, twice, and then opened. Dr. Phillips, I called, trying to keep my voice calm. He's waking up. The whole team gathered around. Mrs. Teresa was there, hadn't left her son's side for even a second. When she saw his eyes open, she let out a sob. Michael, son, can you hear me? His eyes moved, searched, focused on her, and filled with tears. Mom, the voice came out hoarse, almost inaudible, but clear. Folks, there wasn't a dry eye in that ICU. Doctors with 20-30 years of practice crying like babies. Because that was impossible. And it was happening right in front of us. Son, how are you feeling? Dr. Phillips asked, professional voice but emotional. Michael blinked slowly, confused. Where's John? Silence. Who's John, son? Mrs. Teresa asked. My friend. We were at the river. He fell. I jumped, tried to pull him. His memory of the drowning. He remembered. Michael. Dr. Phillips approached. Do you remember anything else? He closed his eyes, concentrating. It was dark, cold. So cold. I couldn't breathe. Water came in. And then what? Then I was floating. There was no more cold. No more anything. It was peace. Silence. But there was a light. Far away. Tiny. And a voice. We all looked at each other. What voice, son? Mrs. Teresa whispered. I don't know, it wasn't man or woman, just a voice. Said, it's not your time. Go back. And I tried to say I was tired, that I didn't want to go back. But the voice got louder. Go back. People are waiting for you. Tears ran down his face. And then I felt everything at once. The cold burning, the body hurting. It felt like I was trapped, trying to scream but no sound came out, banging on something. And then light. Real voices. And you, Mom. I saw you. Mrs. Teresa was sobbing, kissing her son's hand without stopping. Dr. Martinez approached. Michael, I'm going to do some neurological tests, okay? Squeeze my hand. That's it. Now follow my finger with your eyes. Very good. Can you move your toes? Perfect. She stepped back, incredulous. Neurological function apparently preserved. After 12 minutes submerged, 45 minutes of CPR, 6 hours declared dead in hypothermia. She shook her head. This doesn't exist in medical literature. And John? Michael suddenly asked, trying to sit up. Where's my friend? The silence that followed was heavy. Son, Mrs. Teresa held him gently. John, They found John 2 hours later. He didn't make it. Michael closed his eyes, tears flowing. No. I tried to save him. You tried, I said, approaching. Michael, you were a hero. You jumped to save your friend. No one could do more than that. But why am I alive and he's not? He looked at me with those eyes full of pain and confusion. Why me? And that's the question none of us knew how to answer. The following days were exams. Many exams. Brain MRI, no detectable lesions. Lung CT scan, minimal signs of water, already reabsorbing. Cardiac exams, normal function. Complete neurological exams, everything as expected. It was as if he'd never died. But he had died. I saw the death certificate. It was there, filed, signed, dated, official. The news leaked, of course. Local paper picked up the story. Man comes back to life after being declared dead. Reporters came wanting to interview. We blocked everything, patient privacy protection. But inside the hospital, the discussion was intense. It was medical error, some said. They didn't check properly. Declared death prematurely. Impossible, Dr. Morrison countered in a meeting. Flatline on the monitor for 15 minutes. No response to stimuli. Fixed pupils. Body temperature dropping. I followed all protocol. All of it. Then it was hypothermia, others argued. Extreme protective effect. State of suspended animation. For 6 hours? Without life support? Dr. Martinez questioned. There's no documented case of survival under these conditions without severe neurological damage, and he's perfect. On the 5th day, Michael was sitting in bed, eating by himself, talking normally. Body temperature completely normal, stable vital signs, as if nothing had happened. Marina, he called me when I came in to check vital signs. Hi, Michael, how you feeling? Good, really good actually, and thank you for everything. Don't mention it. I just did my job. No. He got serious. You believed when you found me down there. You could have thought you were crazy, seeing things. But you acted. You saved me. Michael, I didn't save you. Whatever saved you, it wasn't me. He gave a small smile. Maybe we'll never know, right? Maybe not. You know what I learned these days here? He looked out the window. That there are things we don't need to understand. There are mysteries. There are purposes. I don't know why I came back. Don't know why John didn't come back. But I did. And that has to mean something. It means you have a second chance. Yeah. He looked at me. And I'm not going to waste it. Michael was discharged a week later. 1 week. From dead to walking on his own in 7 days. The family threw a party at their house when he came home. They invited me. I went. Of course I went. Needed to see with my own eyes him there, at home, alive, smiling. The house was full. Relatives, friends, neighbors. Everyone wanting to hug, touch, make sure it was real. There was a banner hanging in the living room. Welcome back, Michael. Miracles are real. Mrs. Teresa pulled me aside. Marina, I need to thank you. You brought my son back. Mrs. Teresa, No. She held my hands. You listened when something was wrong. You went down to that place at 3 a.m. You didn't doubt. You acted. If it weren't for you... Her voice broke. If it weren't for you, my son would be buried tomorrow. I hugged her. We cried together. Because it was true. If Carol hadn't heard. If she hadn't called me. If I hadn't gone down. If I delayed 5-10 more minutes. Michael approached us, carrying a plate of cake. Mom, stop making Marina cry at my party. Mrs. Teresa laughed through tears, wiped her face. Sorry, son. It still feels like a dream. To me too. he admitted. Sometimes I wake up at night and keep feeling my pulse, just to make sure I'm alive. And how are you dealing with all of this? I asked. He got thoughtful. It's weird, you know? People look at me differently now, like with fear or admiration. Like I'm special, but I'm not. I'm just a guy who got a chance most people don't get. A second chance. Yeah. And you know what I did yesterday? Went to visit John's family. My heart squeezed. How was it? Difficult. Very difficult. His mother is still destroyed, you know? But I needed to tell her that John was a hero, that he saw a child drowning and jumped without thinking, that when I jumped after him he was trying to save that child. And he did. The little girl is alive because of him. I didn't know that. Nobody did. The news only said 2 men drowned, 1 survived. But the truth is, John gave his life to save a 5-year-old child he didn't even know. Tears fell. So I told his mother, "Your son is a hero, and I'm gonna live for both of us now. I'm gonna make it worth it." How? He wiped his tears. I decided. I'm going to study medicine. I blinked, surprised. Really? Really. I was an IT tech, made good money, had a comfortable life. But after going through this, after being cared for by you guys, I realized I want to do this. I want to save lives. I want to be like you. Folks, my heart was overflowing. It'll be hard, I warned. Medical school is tough. I died and came back to life, Marina. He smiled. I think I can handle some anatomy books. We laughed together. 3 months later, I was leaving my shift when I ran into Michael in the hospital parking lot. Michael, what are you doing here? Came for some routine exams. Dr. Phillips wants to keep close watch. He showed a bag. And brought some sweets for the ICU team. Those brigadeiros you guys loved at the party. You didn't need to. I know, but I wanted to. He got serious. Marina, can I ask you something? Of course. Do you think God exists? The question caught me by surprise. I think so. Why? Because I keep thinking. Statistically, mathematically, scientifically, I shouldn't be here. All the odds were against it. And yet you're here. Yeah. And some days I wake up and think, did I really die? Wasn't it a medical error, a deep coma they confused with death? Because that makes more sense, right? It's more logical. And what does your heart say? He put his hand on his chest. My heart says I felt it. That place. That peace. That voice. It was real. More real than anything I've ever felt in my life. Then maybe logic isn't enough to explain everything. That's what I'm learning. He smiled. By the way, started pre-med prep class last week. Biology is harder than I remembered. You'll make it. You're too stubborn to give up. Stubborn enough to come back from the dead. He winked. Today, 2 years later, Michael is in his 2nd year of medical school. Gets excellent grades. Part of a study group on therapeutic hypothermia and rare resuscitation cases. Wants to specialize in emergency medicine. He comes to the hospital every week as a volunteer. Talks with patients. Especially those in serious situations. Those whose families are losing hope. I tell my story, he told me once. And I see hope returning in their eyes. Because if I made it, if I came back from the impossible, then maybe they can too. Carol, the tech who heard the banging in the morgue, still works there. But she says she's never been afraid of that place again. How am I going to be afraid of a place where a miracle happened? She always says. Dr. Morrison, who signed the death certificate, wrote an article for the medical journal about the case. Title: When Science Meets the Inexplicable, a Case of Spontaneous Resuscitation post-declared death, became a reference at conferences. And me? I learned that after 12 years in the profession, there are still things that can surprise me. There are still mysteries. There's still that which goes beyond protocols and equipment. There are miracles. Sometimes I pass by the morgue, now renovated with new equipment, and remember that morning, the muffled sound of banging, the sheet moving, Michael's eyes opening. And I'm grateful. Grateful for going down, for believing, for acting. Because saving a life isn't just about technique, it's about being present. It's about listening. It's about believing the impossible can happen. Michael always says I saved him. But the truth is, he saved me too. Reminded me why I chose this profession. Reminded me there are things bigger than us. Reminded me that hope, even facing the impossible, is always worth it. Last week, he showed me the graduation photo of him with John. 2 boys smiling, hugging, not imagining what fate held. I'm gonna graduate for both of us, he said. And I'm gonna save lives for both of us. That's my mission now. And I have no doubt he'll succeed. If this story touched your heart in any way, know that you're not alone. We all carry our own battles, our fears, our doubts. But that's exactly why stories like this need to be told and heard. If you know someone who needs to hear this message of hope, share this video. Sometimes one story can be the light someone needs to keep going. And if you have your own story to tell, leave it here in the comments. This space is ours. It's safe, and every word matters. I read every comment, and I know many of you also read and find strength in each other's experiences. See you in the next video, with another story that will move your heart. Until then, take care of yourself. Take care of those you love. And remember, life is always worth it. A warm hug, and until next time.